everyone. Today we will learn about points of hand Jueyin Pericardium Meridian. There are 18 points of this meridian, 9 on each side of the body, 8 on the middle of the medial side of the upper limbs, the last on the chest. Points of this meridian treat heart, chest, and mental disorders, disorders of the brain and nervous and the circulatory systems, and conditions of the running course of the meridian. PC1 天池. It is the intersecting point of the hand Jueyin and foot Shaoyin meridians. 天 heaven means high position. 池 pool is a place where water gathers. The point is located in the upper chest. At the same time, it may also be considered as a mountain pool from which water flows to the sea, an image that reflects the way in which qi flows down from PC1 to PC9. Hence its name, 天池, heaven's pool. Location: in the anterior thoracic region, in the fourth intercostal space, 5 cun lateral to the anterior median line. Indications: local problems. First, cough, asthma. Second, mastitis, insufficient lactation. Third, pain in the chest and heart. Manipulation: needle obliquely or transversely, 0.3 to 0.8 cun toward the lateral side of the chest. Deep insertion is forbidden in order to avoid pneumothorax. Precaution: needle PC1 along the long axis of the ribs. Perpendicular insertion is prohibited. Avoid piercing the intercostal muscle in order not to damage the parietal pleura. Care must be taken when using this point in pregnant or lactating women in order to protect the breast. PC3 曲泽. This is the Herse point. 曲 means to bend. 泽 marsh is a place where water gathers. This is the Herse point of the hand Jueyin and belongs to water, like a marsh where water gathers. So it is named 曲泽, curving marsh. Location: on the medial aspect of the elbow, at the cubital crease, in the depression medial to the biceps brachii tendon. Location method: the point can be only located with the elbow slightly flexed. Indications: first, heart pain, palpitation, easy to fright. Second, epigastric pain, hematemesis, vomiting. Third, heat stroke. Fourth, pain in the elbow and arm. Manipulation: needle perpendicularly half to 1 cun. Second, bleeding with a 3-edged needle can be used in such disorders as heat stroke, high fever, and acute gastroenteritis. PC4 细门 C-cleft point. This point is located between the palmaris longus muscle and flexor carpi muscle radialis tendons, which is like a gate. It is named 细门, cleft gate. Location: on the medial aspect of the forearm, between the tendons of the palmaris longus and the flexor carpi radialis, 5 cun proximal to the palmar wrist crease. Location method: with the patient's fist clenched, the wrist supinated, and the elbow slightly flexed, the palmaris longus and the flexor carpi radialis tendon become more prominent. The point is located 1 cun distal to the midpoint of the line connecting PC3 曲泽and PC7 大陵. Indications: first, cardiac pain, palpitations. Second, hematemesis, that is vomiting of blood. Hemoptysis, that is coughing of blood. Third, epilepsy. Fourth, elbow and arm pain. Manipulation, needle perpendicularly 0.5 to 0.8 寸. PC5, 尖使, Jing River Point. 使 means minister or to employ, refers to the function of the pericardium to protect the heart, and 尖 means space. The heart is the governor of other 脏腑 organs. It is like an emperor. The pericardium is like the minister of the heart. The point is named 尖使, the space where the minister passed through. Location, on the medial aspect of the forearm, between the tendons of the palmaris longus and the flexor carpi radialis, 3 寸 proximal to the palmar wrist crease. Indications. First, cardiac pain, palpitations, pain of the chest and hypochondria, epilepsy. Second, stomachache, vomiting. Third, febrile disease. Manipulation, needle perpendicularly 0.5 to 1.5 寸. PC6, 内关. This is the most important point of this meridian. It is lower connecting point and also confluence point of the yin wei mai. 内 means medial or inner side. 关 means gate or pass. This point is the lower connecting point of the hand Jueyin and associates with the yin wei mai, which connects all yin meridians. Heart pain is the main pathological manifestation of yin wei mai. This is a key point for treating 脏腑 organ dysfunction, so it is named 内关 inner pass. Location, on the medial aspect of the forearm, between the tendons of the palmaris longus and the flexor carpi radialis, 2 寸 proximal to the palmar wrist crease. Indications. First, heart pain, palpitation, chest oppression. Second, epigastric pain, vomiting, hiccup. Overseas trials of the recent 30 years indicates that the therapeutic effect of acupuncture on prevention and treatment of post-operative nausea and vomiting, and the use of TENS significantly reduced intraoperative remifentanil consumption and alleviated post-operative side effects in patients undergoing synostomy, basically approved by modern clinical researches. Third, depressive and manic psychosis, epilepsy, insomnia, depression, combined with Du-26, 人中, and large intestine 4 for hysteria. Fourth, pain in the wrist, elbow, and arm. Manipulation, needle perpendicularly 0.5 to 1.5 寸. The tip can reach 3焦5 外关 in deep insertion. Needle obliquely upwards 1 to 2 寸. To treat disorders of the trunk. A 70-year-old man suffering from frequent precordial pain for 6 years. In recent years, frequent attacks of precordial pain with chest depressed, shortness of breath, fatigue symptoms after labor, poor sleep, dark red tongue, white coating, thready and uneven pulse. Treatment with 75mm needle at PC6 内关. After needling, chest fullness relieved. More than 10 times, the symptoms obviously relieved. A 59-year-old woman suffering from palpitations, full chest, and dizziness for 1 hour. After quarreled with others, she immediately felt palpitations, full chest and dizziness. She was nervous, pale complexion, heart rate 170 per minute. ECG showed paroxysmal tachycardia. Treatment: regulate chest qi and calm the mind. Choose both 内关 point. Lift and insert lightly. The needle sensation is transmitted to the elbow Retention the needle for 5 minutes. The heart rate slowed down to 100 beats per minute. Apply the same method again. The symptoms were relieved, and the heart rate reached 90 beats per minute. After another treatment, all symptoms cured. Another report showed acupuncture treatment, tranquilizing the mind, overcoming anxiety of trigeminal neuralgia. Choose local points and hand and foot Yangming meridian points. Combined with Ju 26 Shui Gou, Heart 7 Shen Men, PC8 Lao Gong can significantly improve the effect of relieving pain. PC7 Da Ling. It is Shu stream point and Yuan source point. Ling means mound. The point is located behind a protuberance of bone resembling a mound. So, the point named Daling, large mound. Location: on the medial aspect of the wrist, between the tendons of the palmaris longus and the flexor carpi radialis, on the palmar wrist crease. Indications: first, cardiac pain, palpitations. Second, psychosis. Third, pain in the wrist and arm. Fourth, stomachache, vomiting. Manipulation: first, needle perpendicularly 0.3 to 0.5 cun. Second, needle obliquely into the carpal canal to treat carpal tunnel syndrome. PC8 Lao Gong, yin spring point. Lao means toil or hard work. When one works and makes a loose fist, the point is just below the tip of the middle finger, which is the actual palace of toil because of all the work that the hands do. As the heart spirit located in the palace, hence the name Lao Gong, toil palace. Location: on the palm of the hand, in the depression between the second and the third metacarpal bones, proximal to the metacarpal phalangeal joint. Location method: make a fist with the tip of the middle finger and the tip of the ring finger pressing on the transverse crease of the palm. The point is just below the tip of the middle finger. Indications: canker after, foul breath, nosebleed. Second, mental disorder, epilepsy, stroke and coma, sunstroke. Third, cardiac pain, vomiting. Manipulation: needle perpendicularly 0.3 to 0.5 cun. Local soreness and distension will be felt and can spread to the whole palm. Precautions: the palm is widely distributed with nerve endings. Needling can be painful and must be cautiously used in elder patients with deficient constitutions and pregnant women. Scarring moxibustion is forbidden. The last point, PC9, Zhong Chong, Jingwell point. The point is located at the tip of the middle finger. It is where the pericardium meridian transfers the center of the inner arm and surge forth, hence the name Zhong Chong, middle surge. Location: on the middle finger, at the center of the tip of the middle finger. This is quite special. As the other Jingwell point, they all located near the fingernail. Location method: with the palm upwards, the point is at the center of the tip of the middle finger, 0.1 cun from the margin of the nail. Indications: first, stroke and coma, sunstroke, syncope, febrile diseases, as all the other Jingwell point indications are the same. The second, cardiac pain. This is a special function of pericardium Jingwell point. Third, infantile convulsions. Manipulation: needle superficially to a depth of 0.1 to 0.2 cun. All bleed with a 3-edged needle. Summary: PC6 for regulation of heartbeat rate, blood pressure, heart function. PC6 for acute abdominal pain should towards center 5, combined with deep breathing. Thank you.